Welcome to the UC Riverside 2026 Open Enrollment Benefits Review. This recorded presentation will be available to review at any time and can be found on the UC Riverside Benefits Open Enrollment webpage. All changes to benefit plan information and elections made during open enrollment will go into effect on January 1st, 2026. The plan designs rates have changed considerably this year, and all are encouraged to review all medical coverage options to consider the alternatives. Please note, if your medical plan is not impacted by the changes for next year, or if you are satisfied with the updates to your current benefit elections and do not wish to make any changes, you do nothing. And your current elections will roll over accordingly. There are substantial changes to medical coverage plans, designs, and rates for 2026 and additional changes for non-medical plans. If you are one of those people who never pays attention to open enrollment, this is the year to change that. There will be increases in the HealthNet and Kaiser non-Medicare plans and reductions in cost for the new Blue Shield UC Care and Health Savings Plus plans. We want to stress the importance of reviewing the open enrollment materials on UCNet to see the changes and take advantage of the Alex Benefits counseling tool to assist in finding the best plan to meet your healthcare needs. In this presentation, we will review the new coverage options, added features, revised plan designs, and changes to your costs and out-of-pocket expenses. This information is provided to aid you in making quality decisions about your health and welfare needs. Healthcare costs continue to rise nationwide, and that means your costs may also increase. To keep our benefits program sustainable, we're investing more, partnering with UC Health and changing our strategy. By controlling what we can, we're protecting the security and quality of our benefits program. More information on this important topic can be found in an article posted on UCNet using the links shown on this slide. Let's get started and review the medical plan options. UC will introduce a new PPO medical plan provider for 2026, Blue Shield of California. We will retain the same medical plan providers for HMO coverage through Kaiser and HealthNet, the UC Blue and Gold plan. HMO plans offer care managed by a primary physician who also refers you to specialists for care. The Anthem Blue Cross Medicare PPO plans and the new Blue Shield non-Medicare UC Care and Health Savings Plus plans offer the freedom to visit doctors, specialists, and the medical facilities you wish, including the UC medical centers, without requiring a referral. All medical plans contain a behavioral health benefit, with Kaiser having an additional option for behavioral health care through Optum. Let's review the plan changes for the HMO coverage. There are several legislative mandates that impact the UC Blue and Gold HMO and Kaiser plans. Under legislative mandate SB 729 for 2026, the UC Blue and Gold and Kaiser HMO plans will expand the coverage for diagnosis and infertility treatment to establish a specific treatment cost share that applies to the annual out-of-pocket maximum, increase the egg retrieval and transfers from 2 to 3 per lifetime, restarting the allowance for those who have exhausted visits to start again with 3 allowances. Related prescriptions will be covered according to medication tier level. Legislative mandate AB 3059 adds medically necessary pasteurized human donor milk obtained from a licensed tissue bank as a basic healthcare service, ensuring all California insured families have access to medically necessary donor milk, and simplifies the process for hospitals to distribute donor milk when needed. Legislative mandate APL 23-026 requires health plans to provide coverage for mental health and substance use disorder treatment services offered at a school site when the services are provided by a local educational agency or public institution of higher education. The benefit is available to individuals aged 25 years or younger. Legislative mandate AB 2843, healthcare coverage, rape and sexual assault implemented in July 2025 for HealthNet and Kaiser. requires health plans to provide coverage for a 9-month period without cost sharing for urgent, emergent, and follow-up medical, mental health, prescriptions, substance use disorder, and other treatment and care following a rape or sexual assault. The mandate prohibits applying conditions or the requirement to receive care unless the individual files a police report, to file charges against an assailant, or for an assailant to be convicted of rape or sexual assault. Another health net change is the enhancement of coverage of GLP-1 medications used for weight loss and treatment of diabetes. In 2026, there is a prerequisite for this medication for weight loss, requiring a body mass index of 40 or higher to be eligible to be prescribed the medication. Those currently using the medication will not be subject to the minimum BMI level if physician certifies medical necessity. The prior authorizations manager for musculoskeletal care and pain management will move from Turning Point to Evelyn starting January 1, 2026. Virtual cooking classes is an added benefit for UC locations offering 5 classes at no cost. Under the Kaiser HMO plan, the coverage for the medically necessary GLP-1 weight loss medication benefits differ slightly. The eligibility criteria for weight loss medication for those who began treatment with a BMI below 40 will not have access to the medications if they do not have a comorbidity as outlined by the Kaiser plan. The Kaiser Senior Advantage Plan catastrophic true out-of-pocket maximum will increase to $2,100 and the emergency room copay will increase to $100 and waived if admitted. The inpatient hospital copay will increase to $350. Now we'll review the PPO medical plans. New for 2026 is UC's restructuring of the PPO medical plan options with the move to Blue Shield as the PPO plan insurance provider for non-Medicare retirees. Medicare-eligible retirees will continue under Anthem Blue Cross as the plan administrator. There were further decisions to discontinue Core and the Health Savings PPO plan and replace them with an enhanced Blue Shield UC Care PPO and new Health Savings Plus high-deductible health plan with the Health Savings account option. Navitas remains the manager of pharmacy benefits. The following slides will offer a comparison of the plan design changes between Anthem Blue Cross and the new Blue Shield coverage. Accolade remains as the member services and care advocate, and Navitas remains the prescription benefit manager. This slide shows a comparison of the calendar year deductibles and out-of-pocket maximums for the new Health Savings Plus plan versus the previous Blue Cross plan designs. You will see a single and family deductible with the Health Savings Plus plan for in- and out-of-network providers. The out-of-pocket maximums for in-network and out-of-network providers will also increase for the new Health Savings Plus plan. For preventive care, the in-network zero deductible remains the same and the doctor or specialist's visits coinsurance increases to 30% for in-network and 50% for out-of-network providers. Accolade offers virtual primary care at a $30 copay before the deductible and virtual behavioral health care at 30% of $30 after the deductible has been met. A virtual second opinion from a leading specialist, acupuncture, and chiropractic in-network services are available at a 30% cost share after the deductible is met and 50% cost share for out-of-network providers. Urgent, emergency, ambulance transport, and retail clinic services increase to 30% cost share after the deductible is met. The deductible is waived for ambulance emergency transport. Hospitalization services have a 30% copay for in-network services after the deductible has been met and a $360 per day benefit maximum with inpatient stays. For prescription coverage, the high-deductible Health Savings Plus plan has a 30% in-network and a 50% out-of-network cost share after prescriptions are paid at full cost until the deductible has been satisfied. Mail order options are available for 90-day supply of medications. The health savings account is available only to those enrolled in the Blue Shield Health Savings Plus medical plan. The IRS contribution limits for 2026 increases for single members by $100 and $200 for family coverage. Non-Medicare retiree contributions to the HSA plan are made with after-tax dollars directly to the health equity account. Those age 55 and over may make catch-up contributions, and health equity remains the plan administrator. To participate in the new Health Savings Plus plan, retirees cannot be enrolled in Medicare Part A or Part B. This also excludes split family members where at least one member is enrolled in Medicare. Non-Medicare retirees who were not enrolled in the UC Health Savings Plan as an employee are eligible to elect the new Health Savings Plus plan during open enrollment. It is very important for members in either CORE or the Anthem Blue Cross UC Health Savings medical plan to understand that UC will automatically transfer the enrollment to the Blue Shield Health Savings Plus plan. Those with split families, one in Medicare, one not, will be automatically transferred to UC Care and the UC Medicare PPO plan. Once enrolled in the Blue Shield plan, any member with a health FSA plan with a balance of $25 or more will have funds moved to the Limited Health FSA managed by WEX. Those funds must be used for non-medical expenses, vision, dental, by the specified end date, or they will be forfeited. The UC Care plan will remain an option along with the new Health Savings Plus plan managed by Blue Shield. The infertility benefits will be transferred to Blue Shield, and the plan administrator will transfer to Win Fertility. Pharmacy benefits are covered at a 50% cost share after the deductible is satisfied for in- and out-of-network providers. Pharmacy benefit changes will exclude the savings from copay savings cards being applied to the annual out-of-pocket maximum. Members currently using GLP-1 weight loss medications must have a body mass index of 40 or higher, and those starting the treatment program with a BMI of 40 plus may continue after being recertified for medical necessity. Benefits for lodging and food expenses when traveling for surgery have increased and now include benefits for gene therapy for ocular disorders. The international coverage coinsurance for members will remain unchanged at 20% for services provided during international travel and continues to be managed by Blue Cross Blue Shield Global Core. Travel vaccines will also see changes for UC Care and the Health Savings Plus plans implementing costs based on provider tier and in- and out-of-network status. United Healthcare offers the UC Medicare Choice Medicare Advantage PPO plan to Medicare-eligible members. This is the comparable Medicare plan for retirees enrolled in the HealthNet HMO plan. UC Medicare Choice will see increases in copays for emergency room visits, inpatient hospitalization, Part B medication copay, Part D deductible for Tier 3 providers, and Part D copay for Tier 4 specialty medications up to $150 per prescription. The Silver Sneakers Fitness Program will end and Renew Active becomes the new fitness program provider. The personal emergency system will no longer be a covered benefit, but the Calm app will be an added benefit. Member ID cards will be issued to new Kaiser members, and all members with HealthNet, UC Blue and Gold, will receive new ID cards. Non-Medicare PPO plans administered by Blue Shield will receive one combined new member ID card for medical and Navitus pharmacy care. Health Equity will issue new cards to new members only, while existing members will continue to use current debit cards for the HSA plan. UC Medicare PPO plans will continue to be administered by Anthem Blue Cross and Navitus. There will be no move to Blue Shield. All will receive two ID cards, one from Anthem for medical, the other from Navitus for prescriptions. UC Medicare PPO without RX, all members will receive a medical ID card from Anthem. Anthem Health Guide will continue to provide customer service to the high option and without prescription coverage plans. The Medicare Coordinator Program, administered by VIA Benefits, remains the available medical plan provider for retirees, with all members enrolled in Medicare living outside of California. UC retirees eligible for medical coverage, enrolled in Medicare Parts A and B, not receiving UC disability income, and not diagnosed with kidney disease may apply. VIA Benefits offers a wide variety of health plan options and insurance costs for members to make quality decisions about their healthcare needs. The UC annual contribution to the health reimbursement arrangement will increase by $1,000 to help those enrolled in the VIA Benefits program pay for eligible health expenses. The benefit is issued based on retirement service credit or graduated eligibility, and members could receive up to $4,000 for the retiree and $8,000 for retiree and spouse or domestic partner. The HRA will be available on January 2, 2026. VIA Benefits open enrollment runs from October 15th through December 7th. Members may view funding eligibility via the HRA Estimator tool found on UCNet at the link on this slide. Let's review the changes in the cost for coverage for retirees. All retirees may view the Retiree Premium Estimator tool to determine the monthly premium based on graduated eligibility. The tool is found on UCNet and available at the link on this slide. The non-Medicare eligible retiree share of the costs for coverage is noted on this slide and based on the full contribution offered by UC. You will notice increases in the HealthNet and Kaiser plans and decreases in the premiums for the new Blue Shield PPO plans. Please review the Retiree Premium Estimator tool to find your premium if you earn less than the full UC contribution towards the cost. The Medicare eligible retiree cost share is noted here with increases in the Medicare reimbursement benefits for Kaiser members, more cost share with United Healthcare, and decreases in monthly premiums for the new Blue Shield Medicare PPO plans. For those over age 65, but not eligible for Medicare, the costs for coverage is shown here and subject to graduated eligibility. The exact monthly premiums may be calculated using the Retiree Premium Estimator tool found on UCNet. We will now review the updates to the non-medical benefits. Delta Dental continues as the dental provider. Coverage for Delta Dental Premier and out-of-network providers for certain services are increasing from 75% to 80% based on the plan allowance. There are no benefit changes for the HMO plan designs. There will be a premium increase of 2.13% for the PPO coverage and 2.48% for the HMO plan that is reflected in the graduated eligibility rates found on the Retiree Premium Estimator tool on UCNet. The VSP Vision Plan also remains the same, and there will be a premium increase of 5% that is reflected in the graduated eligibility rates found on the Retiree Premium Estimator tool on UCNet. The ARUG Legal Benefit Premium remains unchanged. Be sure to take advantage of the benefit of creating a living trust at no cost and a wide network of available attorneys to assist with a variety of legal issues like consumer fraud, personal property disputes, and family law events. The UC Paid Experian Identity Theft Protection Plan remains available and has a credit college program available. Enrollment is automatic and members select the data elements to be monitored. Nationwide Pet Insurance is available by applying directly with Nationwide to obtain quotes for coverage year-round, not only during open enrollment. The UC Riverside Central HR Benefits team is available to provide an extensive explanation of your benefits. Please feel free to reach out to us at benefits@ucr.edu at any time, and we will be happy to assist you. Thank you for joining us. This concludes our presentation. We hope you found the information to be helpful and obtained what is required to make quality decisions about your health and welfare needs. Thank you for your time.